So without further ado, let me introduce Leslie Pibouleau, who's not with us here today, virtually here today, but she has a Paris background. She studied here. She has a Master of Science from Paris University and a PhD in Statistics, Bayesian Methods. And then she started out at Haas in France, I'm sorry, and moved then to DG Santé in Brussels. So she's well-educated, optimal background to, how should I say, navigate the process and give us some insights from a DG Santé perspective. Thanks for being with us, Leslie, and the floor is yours.
Many thanks to you. Many thanks for having me today. And I would have very much preferred to be here with you in person. But, you know, there is the joint clinical assessment subgroup today in person in Brussels. So I had to be there. And like you say, so now I'm working. And in addition to that, that would have bring back memories to me, because in this exact same building, I used to teach biostatistics to med students some years ago. So yes, so at the Commission, I'm working in the HTA unit, and so as you know, the Commission provides the secretariat to the HTA coordination group and its subgroups. So, and more precisely, in the HTA secretariat, I'm supporting the joint clinical assessment subgroup. I will now share. So I've prepared. I will now share my presentation. And
yes, we can see it.
Yes. Okay. So I have just prepared a couple of slides to introduce the HTA regulation, because I didn't know exactly what was the level of knowledge of all participants, but I will be very quick. And please apologize for those for which it's a repetition. But just to remind us all that our regulation is in application now since January 2025. And it establishes a support framework and procedures for cooperation of member states on HTA at union level, so all HTA bodies from all member states, EFTA countries. And it provides a mechanism for the submission of evidence for joint clinical assessment only once at union level, meaning that there is one JCA dossier to be submitted by health technology developers, and there will be one JCA report to be used by HTA bodies at national level. The HTA, the joint clinical assessment are only about relative effectiveness and relative safety. So meaning only because other criteria can be taken into account at national level for decision making. For this joint clinical assessment, and we'll see next also joint scientific consultation, of course, there are common rules and methodologies between member states that are needed and that are developed by HTA bodies, so represented in the HTA coordination group. So the vision here is to improve the patient access to innovative technologies, like you previously said, and also strengthen the quality of HTA all across Europe. And because there is this single mechanism of submission of dossier and a single assessment, it's to avoid duplication and to improve efficiency. Now, when we talk about joint HTA activities, there are actually 4 different ones. So we have the joint clinical assessment, joint scientific consultations, the identification of emerging health technologies with major impact. So we are here more on horizon scanning activities, and also, of course, all the development of methodologies to support the joint clinical assessment and joint scientific consultation. So as regards the joint clinical, and all of these activities are done both for medicines and for certain high-risk medical devices. So for medicines, you know that this is all medicine going through the centralized procedures at EMA. And but the full scope will only be reached on from 2030. It will also include extension of indication, but only in the cases where there is already a JCA report that has been produced. And we have adopted here a staggered approach. So we have started in January with new active substance for cancer medicines and also ATMPs. The joint scientific consultation, so also known at EMA as scientific advice, it is also both for medicines and medical devices in view of potential future joint clinical assessments. And it can be done in parallel with the European Medicines Agency for medicines, but also in parallel of the expert panels of medical devices for devices, and which Secretariat is also hosted at EMA. What I wanted to highlight here in view of our discussion targeting SMEs is that there are no fees currently for JCS and GSCs. So there will be an evaluation of the regulation from 2028. And in this context, there are aspects to be considered also the possibility to introduce a fee-based mechanism, but for now, there is no fees. This slide on governance, I won't go into detail. I'm just using it to clarify the respective roles of member states, commission, and a third actor, which is crucial here, is the stakeholder network. So as you know, the EU HTA framework is member states led. So the main governance body is the member state coordination group on HTA, and it is made up of representative of HTA bodies of all EFTA countries. And it has 4 subgroups that each of them correspond to the activities that are previously presented. And each of them, they're in 2 configurations with experts for medicines and experts for medical devices. The Commission, so the member states, they conduct the joint eco-assessment, they conduct the joint scientific consultation, they develop all of the methodological guidance, and the Commission here is here to provide support, so administrative support, technical support, IT support, legal support. The Commission is dealing with all the conflict of interest. The Commission is also looking at identifying patients, but it's the GSC and JCS subgroup that does the selection of patients based on those identified by the Commission. You can see on the left, on the right, so the HTA stakeholder network, which is extremely important in our framework. And the stakeholder network now accounts for 71 organizations. These are umbrella organizations, so that needs to have a geographical coverage for several EFTA countries. So 1/3 is with patients. We have approximately 1/3 with clinicians. Industry is represented, and UCOB is one of our members. And you have also learned societies and payers. So the HTA stakeholder network has been crucial also in the preparation of the implementation of the regulation. We have seen 2 annual meetings, and there are, for example, 2 working groups that have been established, one for the evaluation of the regulation, and there is also one with clinicians and patients on the process for identifying patients. On the bottom here, you can have also something that is key, is the HTA IT platform, which is our instrument, our tool to exchange all confidential information. So each actor has his own dedicated space, and we have developed also workflows for JCAs and GSCs. Now, if we go more into the details about when we do interact with as technology developers, I've taken here the example on JCAs, on medicines, and you can see that there are 5 phases. With the phase 0 is the preparatory work, and it starts with when the developer sends a letter of intent of third-year marketing authorization application to the HTA Secretariat, and this in parallel to the EMA letter of intent submission. And this is very important for us to organize the work in advance, for member states to allocate resources, identify potential assessors, and you can see that during this preparatory work, it might be that the HTA Secretariat could have, some clarification question for you. And in that case, so you will receive an email, and some type of question could be, for example, about the type of combination products, or if we are unsure whether the letter of intent, the third-year application will cover one or several applications. But all of this is very crucial for the preparation of the JCA. Then when the developer submits the application for marketing authorization at EMA, it shall also share the SMPC and clinical overview to the HTA Secretariat. Then based on this element, the JCA subgroup appoints assessor and co-assessor. And once the marketing authorization application is validated by EMA, the HTA Secretariat informs the HTD about the start of the JCA. Then we are in the assessment scope development phase, which is done by the JCA subgroup. And it might be also that the assessor and co-assessor might have some question to the HTD, clarification question in the scoping process. When the JCSF group has finalized the assessment scope, the assessment scope is sent to the HTD with the Commission first request for the dossier. And next, the developer can ask for an assessment scope explanation meeting, which has to take place within 3 weeks after the reception of the first request or the finalization of the assessment scope. And as you know, the developer has 100 days to develop the dossier. Next step is for the developer to submit the dossier. In this context, the HTA secretary sends a reminder 2 weeks in advance, not really to remind you that you have a dossier to submit, but just to check if everything is okay from a technical point of view from your side, to make sure that any technical issue can be solved in advance. And then we go into the confirmation check of the dossier. During this phase, the developers may also receive questions from technical questions from the secretariat if there are any issues with opening the files, naming of the files, etc. But then also there may be a second commission request in case of missing information in the dossier. Once the dossier is confirmed, then the JCA, so after the HTD submits the dossier, we are in phase 3. So the JCA, the assessor, co-assessor starts drafting the JCA report. And during this phase, there are 2 types of interaction that can take place in a way. So there can be question coming from the assessor and the co-assessor about clarification or additional information that is needed for the assessment. And in this case, it's up to the assessors to set up what deadline they will give to the developer. Can be between 7 and 30 days. But there can be also a situation where it's the developer that proactively sends information in case there are new clinical data available on the product. And then we go towards the finalization of the JCA report. And here there is the accuracy check to be done by the developer. Next is the endorsement by the coordination group. And finally, so the compliance check by the Commission and the publication by the Commission. So that to give you an idea of the process and what are the different points of interaction with the developers. So what are the modes of communication with developers? So the point of contact is always the HTA secretariat, and all exchanges of product-specific information has to take place via the HTA IT platform. The first step, so for the JCA and JSC process, is for you to request a dedicated space, and this is done by email to the HTA secretariat. So for JCA, it's when you're ready to submit a letter of intent to EMA, since you have to submit it in parallel to us, you ask for a space, and the secretariat creates this space and gives you this information via email with instructions on how to use the space. You can see the email address here. For joint scientific consultation, it's during a request period to submit a request for a GSC. And then all subsequent exchanges of confidential information shall take place via the HTA IT platform. There is also, once you have access to the IT platform, you can find there a user guide that has been developed with a focus to HTD tasks. Then for general inquiries on the HTA regulation or on non-product specific aspects, you can always send email to the HTA secretariat that will reply to you. And if needed, the reply will be done in consultation with the chairs of the coordination group and subgroups. And to have everybody on the same level of information, we try to group the reply that we gave to individuals in a frequently asked question that is published on the EAA website. So there is now one on scope, but that will be updated, and our objective is really to publish more of them. So this is just a screenshot of how the HTA IT platform looks like with the different spaces. And this is what developers can see when they have access to their space and where they can share documents, upload files, etc. So now, where to find information for developers? We have the HTA webpage on the EAA website where you can find all up-to-date information. So, of course, the implementing regulation, there are 6 of them. the list of ongoing JCAs, all key documents, so all the guidance documents that have been adopted by the coordination group, but also the agendas of the meetings, so all meetings, JCA, JSC, etc., all subgroups and coordination group, and the minutes of these meetings. There are also the frequently asked questions. On this website, on this webpage, we also announce events, and you can find there also recording of events. So we had the HCA conference on the 2nd of July, but we also organize frequent webinars. Our plan is, so we are in the doing of developing a web page dedicated to developers. So a little bit, if you wish, like what you can find on EMA website, where very practical information and what are the next steps and where to find documents, etc. As regards webinars, so they are bi-monthly webinars, so they are targeting HTDs, developers, or individual patients or clinicians or patients. The webinar targeting developers, so the last one was on the 17th of October. You have the link here. And the next one won't be on the 12th of December, but with a focus on medical devices. So all webinars are announced on the Europa webpage, and you can register this there online. And the material of the webinar is also made available on the Europa website, so you can find the presentation and the recording. So during these webinars, actually there are the chairs of the different subgroups that provide an updates. The Commission also provides an update more on technical aspects like the IT platform, etc. And then during the webinar, there are Slidos, so we try to answer as many questions as we can. And here again, our objective would be to have to group this question and to have to reply those that were not replied during the webinar or so, and to have a Q&A on our website. So we are really learning from the short experience, I would say, we have with the first JCAs and GSCs. So we have 9 ongoing JCAs, and we have 5 GSCs, and 2 of which have already been completed. So as you see, we are really we are really starting working in a way. So like I say, for developers, and here that would be extremely useful for us to know, because we're aware that SMEs have specific needs, and that to make sure that we can address them, we are very interested in knowing from you what would be needed, so that we can integrate that, in particular in the web page that is in the making. So our question for you is, what could be helpful for companies in navigating the EU HTA regulation, and also what are the specific needs of SMEs? And as you see, we don't have the background experience of EMA yet, because the first product that we received, it was in March only this year. So we are talking here about less than 6 months, but it's certainly something that we are aiming at. And so we will like to do this with your input, of course. And once again, the stakeholder network is also one opportunity to provide input. But I'm very looking forward to hearing from you and your suggestions. Thank you.
Thanks very much, Leslie, for this great overview, and also for the questions in the end, because my view is always it's a collaborative effort to make this regulation successful in the interest of patients and the society. So we will try to work on those questions and give that feedback